Innovation transforms the world, turning the status quo upside down. Innovation created a healthcare system that not only improves the lives of veterans, it transforms the lives of healthcare professionals with unique opportunities to work with industry thought leaders while serving our nation's heroes. The Department of Veterans Affairs, where innovation ensures those who served our nation are served by the very best. See how a career at VA can transform your future.
Well, happy Tuesday and welcome to VA Careers Live. My name is Mike Owens and I'm a national recruiter with the Veterans Health Administration, as well as your host for our weekly segment, Talk About It Tuesday. If you're tuning in for the first time, I just want to let you know that we are here every Tuesday at 12 noon Eastern Time. So feel free to grab a snack, grab something to drink, and join us as we talk about careers here at VA. Now, again, whether you're tuning in for the first time or you've been with us for the last 2.5 years, we really want you to be part of the conversation. So don't be shy. Leave those questions and comments in the comment section below. Our team and I will go through those comments and questions throughout the day and throughout the week. And we'll make sure that all of those questions are addressed, all those questions are answered, and all those comments are addressed. And lastly, we all know someone who wants to work here at VA. So we would like you to help us to get this information out to as many people as possible. So we ask that you please, remember I'm saying please hit the share button. And we have a special hashtag that's associated with this program. That's hashtag work at VA. Again, hashtag work at VA. Hit that share button and let's get this information out to as many people as possible. So with that, we're going to our program today. We're going to be talking about the Health Professional Scholarship Program today. We have a special guest with us. Our guest today is a 2022 Health Professional Scholarship Program recipient. Our guest today is a fourth-year student of Tulane University School of Medicine. She's lived all over the world. Her dad was in the Air Force for over 20 years, and her dad even worked at the VA for a little bit over 12 years. So we're excited to have her. Today we have Miss Ariane Sacramento, and I am happy to welcome her to our program. Hey, Ariane, how are you?
Hi, Mike. Thanks for having me.
Awesome, awesome. And as we were talking before this program, it's funny how different names are pronounced so differently in different parts of the country. Where you're from, you guys say Ariane. Here in New Orleans, we say Ariane. So, but you know what's amazing is I finally have a guest that's in the same city as me. So I'm glad to be able to interview someone that's currently in New Orleans. So are you ready for our interview today?
Yes, I am.
Awesome, awesome. So we're going to start with our first question of the day. So you're a fourth-year student at the at Tulane University School of Medicine. So when did you first know you wanted to pursue medicine?
Yeah, so this has been quite a journey, I guess I would say. So when I was younger, I used to watch Doogie Howser with my dad. And I think that was sort of around the time where that sparked an interest in medicine.
You're telling your age saying Doogie Howser.
A little bit, a lot of it. And I think in middle school or something, we had to write a paper of like what we wanted to be when we grew up. And I did talk about being a physician. So I went into college thinking I was going to go into medicine. But as we know, like college is sort of where you find yourself in more ways than one. And I ended up really liking a lot of other things. So I liked to learn. I liked asking questions. I was always very curious. So I thought I wanted to be a researcher for a really long time. So I kind of pivoted and I started taking classes in terms of teaching. So if you're a researcher, you have to be a professor as well. So I did some teaching classes. I got into research. And then I did that for about 8 years after graduating college. So nearly a decade after graduating college. But I sort of just felt like I wasn't getting what I wanted. Like it was a fulfilling career, but I sort of missed people. I missed talking to people, and I missed having sort of that face time with patients. And I looked around the room of everyone that was in like conferences that we were at or conference meetings that we were at. And I thought that the MDs that were there were sort of, they had the life that I wanted to have. My PI, my primary investigator, my mentor, I guess you would say, the guy that hired me at my last job, he's very supportive of me taking new classes because it's been a minute since I've taken classes to prep my application, and then ended up at Tulane, and that's just sort of how that started. But always had an interest in serving individuals, serving people. I always had an interest in medicine, and always had an interest in making a positive impact in lives. And I thought medicine was the best way for me to do that.
Awesome, awesome. So once you get into the workforce after you finish residency and everything, if you have a nickname, we're going to make sure we call you Hauser, Dr. Hauser. I'm just kidding. I'm just kidding. But yeah, I enjoyed that show when I was younger too. It's always awesome when someone's talking and you're interviewing someone and they mention something from your childhood. It's always good to hear. So I won't bore you with that. So we're going to go to our next question. So the Health Professional Scholarship Program, we all know it pays for medical school tuition and authorized fees. In addition, you get a monthly stipend and an annual education expense payment. So in return, anyone that's a recipient, you agree to practice medicine for 18 months at a VA facility. What about this program appealed to you? Why did you decide, okay, I want to be a part of this HPSP program?
I think the biggest appeal was just serving veterans. So my dad's a veteran and my godparents are also veterans. I have some cousins and some other family members and friends who are currently serving and are going to eventually be veterans as well. So I knew I wanted to get into the VA system eventually. That's something that I talked to my dad about for a very long time, even prior to, I think, coming to medical school, because he worked at the VA and he knew it was a great place to work at as well. I don't remember how it happened, but I got word that there was going to be a VA HPSP for physicians somewhere around like 2020 or something before it went live. And that was something that I brought up to my dad. I was like, I feel like this is a good program. What are your thoughts on it? Not going to lie, the paying tuition is a very big plus. But in reality, it gives you like a direct path to working with the VA system in a way, because you're obligated to work for a VA after residency and after fellowship anyways. So it kind of made it more of a reality that, I wanted to work for the VA, and it's going to be a little bit more of a reality at this point in time.
Awesome. Awesome. So our next question is, a lot of physicians and medical professionals, they undergo a lot of training at VA. You could walk through, a VA facility and see all types of different specialties of physicians and people in all different, I guess, parts of their journey in their physician careers, whether it's residency in the beginning or they're at the latter part of their careers. So what would you say, what did you learn about VA during your internal medicine acting internship at the New Orleans VA?
Yeah. So this is a good question, and I'm going to step back a little bit. So I actually did my internal medicine clerkship as well at the VA. So the clerkship is the third-year clerkship, and then the acting internship is what I did in fourth year. So during third year, we do all of our rotations in all of the core specialties, including internal medicine. And I had asked to be at the VA partly because it was prior to when I even decided to apply for the HPSP. And I wanted to see, I have this dream of working at the VA system, but I never actually experienced it. So let me experience it first. And then if I like it, then I will apply. So I think I ended up applying in January. So it's a rolling scholarship, a rolling program of acceptances. And I guess the first thing that's the first experience of internal medicine in general. So I learned all about internal medicine and medicine at a VA system. What I learned about the VA is it's a little bit homey, I guess. There's a familiarity of the VA. I haven't been on a base or living on a base since 2003, I think, was probably around the last time that I lived on an Air Force base. We got stationed back to the States around that time. Prior to that, we were in Air Force bases around Japan. And it just felt like home in a way. So I had this idea of wanting to work for VAs, and I had this dream of doing like serving veterans, but being in the thick of like other veterans in general and their families and loved ones as well, it just seemed very familiar. So I learned that it was a place that was going to be like coming back home, I guess, in a way. The other things I learned about the VA is how thoughtful the institution or facility itself is. Sort of like the design of a VA facility is meant to be better for veterans, like the openness of it, how thoughtful they were on like, let's have this really big open space. Let's make sure that everyone feels like it's a community. And that's essentially what it felt like when I was at the VA. Different than the other hospital systems that I was actually rotating at prior to that. Other hospital systems felt like a hospital, but the VA to me didn't feel like a hospital, right? I know that there were patients there, but everyone walking around, milling around and having conversations. It did feel like a community in that way. I also knew that there were other folks that were like me who wanted to serve veterans too. So there are definitely folks who either have a military background themselves or grew up in a military family. And so having that sort of camaraderie was also there at the VA. And then just the access. And then the sort of, I don't know if I should say patience, but we're going to do everything we need to do to make sure that these veterans who are in service are going to be able to succeed outside of this hospital system, which is something that not all hospital systems sort of have in place, you know. So I think that was also something that I really enjoyed about the VA. You know, we try not to, I guess the best way to say is that there's no major cost to a veteran who's getting care at a hospital system, right? So having all that access to everything that we need to do and what they need to have, as far as from like a wheelchair to a scale, for instance, that they might need to have at home, was something that we didn't have to think too hard about, because we'd be able to provide that for them. So I thought that was also really cool.
Awesome. So before we move on, I just want to, for anyone that may have just jumped into the interview, I'm talking to Miss Ariane Sacramento. She is a fourth-year student at Tulane University School of Medicine here in New Orleans, and we're talking about the VA's Health Professional Scholarship Program, where she is a 2022 recipient of that scholarship program. So if you're tuning in and you missed the first part of the interview, you can always go back to our LinkedIn page. This interview will be on our LinkedIn page, and you can go ahead and watch what you missed. So with that, we'll continue with our talk with Ms. Sacramento. So I know from watching this program, from watching this interview, there are some people like, okay, what is the HPSP program? And I'm interested in that. So what advice would you offer someone who's interested in the HPSP program, or just any general, you know, what advice would you give someone who's just interested in working with VA?
I think, I guess the first advice I'd be about the HPSP program is to really read the fine print. I think a lot of the time people go into something thinking, oh, it's, you know, this entity is going to pay for my tuition, and that's all I really need to know. Everything else really doesn't matter. So I think a lot of folks need to be also thoughtful about what they want to do for their lives and what they see their future as, and to read everything that this HPSP program has to offer is sort of very important to do. I also think that if you get a chance to just sort of either shadow or work at a VA system, because, you know, waiting until your third year of medical school, you can get the scholarship as a first year medical student, right? If you wait until your third year to see what the VA facility is, you might be either pleasantly surprised or just mildly disappointed. And so I think it's good to know what system you're getting into ahead of time. I'm biased. I think the system is great, but you definitely, folks who might not have the same passion for veteran care as I do, because I have the veterans in my family, should also look into working at a VA system. With that said, if you're interested in working at a VA system, also know that since it's a since it is a VA, there's a good amount of prep work prior to working for the VA. So there's, there's like a special card that you have to like access everything or access the system itself. So if you are interested, I would start that sooner rather than later. I've actually been fortunate enough to have some individuals reach out to me to talk about this, and that's similar to the same advice I give them. If you're interested in it, get involved early, because getting access to things is also kind of, it might take a little bit longer than you imagine it would take. And then also just know where you're going to work. Most VAs, I've only ever worked at the one VA, but I've talked to folks who worked at other VAs, and we're of the understanding that there's still, a generalizability to a VA system across the nation. So if you're in one location, I think it doesn't necessarily matter. They might have different things than New Orleans does. I think New Orleans VA is fairly new. It's a recent build in the last decade or half a decade or so like that. But I would do that. I would do your homework, and then really make sure that the system, like the HPSC, is conducive to something positive to your life and to your future goals. And then if you're interested, to reach out sooner rather than later.
Awesome. So, final question for today. What would you say is your absolute favorite thing about training and working at VA?
I think it's a very cliche answer, but it's the only thing I can think of. A lot of the time, I really like the people. So I haven't had an issue. I shouldn't say with everybody, but I haven't had an issue with most of the folks that I've worked with at a VA system. The nurses have been very welcoming, especially to someone who's a third-year medical student and now fourth-year medical student, who basically, really doesn't know much of anything of what's going on. But they were open to having conversations with me and to letting me know how the EMR works, what they need from the physicians to let them push forward patient care, for instance, and vice versa. So I really liked working with the individuals there. I also had an attending who's come from a very strong military family as well, and I learned a lot from her. And I think that the interdisciplinary folks, the ancillary services, have also been really great to work with. And then the veterans, I don't know if it's because I have that face or veterans just like to do it themselves, but we get a lot of good stories from patients if you give them the time to talk to you about it. I can't tell you how many times I've seen photos as well. I think one patient I've had wanted to show me his whole boat collection or something like that.
And if you listen, they'll show you everything.
Exactly. So so having conversations with these veterans and knowing what their past was like and how they got to where they're at, and there's a big wealth of knowledge in the veteran population as well. So the people have been the best part and my favorite thing about training at the VA.
Awesome. So I think I kind of fibbed there for a second. I said that was your last question. I have one more for you. I'll put you on the spot. So you said that your dad was in the Air Force and you've traveled all over the world. What was your absolutely favorite duty station?
Yeah. I think that, I'd probably say Yokota Air Force Base. It's right outside Tokyo, really, really close to Tokyo. We were there for a good bit. I want to say we were stationed there twice. I think we got stationed there and then it got extended for a little bit longer. I really liked it there. It actually fits with why I like New Orleans a little bit, because it was a very humid location as well, and it could be very hot and then it could be very cold at some points, and then I don't know, and it was big enough for there to be a good amount of people to have that community.
Yeah. That's awesome. It's funny hearing you talk about New Orleans, because every time you ask someone about New Orleans or they describe it, they have different things that they like about it. And it's the first time I heard someone say, I love New Orleans because it's hot and humid. You know, but it's good because we don't have those very cold winters here. So you don't have to worry about snow and wearing 3 layers of clothing like some of our other friends that are watching us on this broadcast right now. So, but with that, Ariane, thank you for taking time to be with us today. We really appreciate it. We know that, you know, being a medical student and doing what you do takes a lot of time, and, you know, taking this half an hour to talk with us. I just want to personally say on behalf of my team, I'm very excited and I'm very happy that you decided to join us today.
Yeah, thank you for having me and inviting me. This is great.
Awesome, awesome. So for our audience, again, we were talking about the VA's Health Professional Scholarship Program. Today we were talking with our 2022 recipient of that program, Ariane Sacramento. Again, if you missed part of the broadcast or you came in towards the end, you can always go back to our LinkedIn page and watch the interview in its entirety. There's a lot of good information. If you have any questions for Ariane, leave that in the comment section. We'll make sure to forward those questions over to her, and we'll make sure you get the information that you need. So with that, thank you for watching, and we will see you on next week. Have a great day.